Secret number 3. Perform every single objective test. This is secret number 3 of the interview and physical examination secrets. So, what is an objective test? Well, an objective test is one of those tests that requires a reading, a measurement, an angle, a recording, a calculation. Usually it's some numeric finding that is obtained from some type of an examination instrument. Now, in contrast to an objective test is a subjective test. For example, palpation for muscular guarding of the lumbar paraspinal muscles. That is a subjective test because there's no recording, there's no angle, there's no measurement that's obtained from an instrument. And we want to focus our examination on the objective tests. And we want to give objective measurements and objective findings and objective readouts and objective recordings. Nothing demonstrates more to the examinee and also to the reader of the report your accuracy, your thoroughness, and your precision than exact measurements on objective tests. Make sure to use exact measurements. Don't round off your numbers. And make sure to have the appropriate instrument or tool for the measurement. For example, I have a listing here for you of several different types of objective tests, and this is not a complete list, but these are just some of the objective tests that are required through the AMA guides. In the spine, range of motion measurements, those provide objective recordings and readings through the use of inclinometers. And I myself personally, I use dual digital inclinometers, and I really like the digital inclinometers because it gives exact readings, and the readings aren't rounded off to the nearest 5 degrees. In my opinion, and you'll probably agree with me, is that range of motion measurements rounded off to the nearest 5 or even the nearest 10 degrees smack of incredibility to me. I don't know about you, but I find exact measurements such as 33 degrees, 49 degrees, 51 degrees much more credible than 30, 40, and 50 degrees. So use exact measurements. In the spine we have inclinometers. For the extremities we have goniometers. We have long arm goniometers, short arm goniometers. We have finger goniometers for doing hand evaluations. For measuring forearm pronation and supination, we have baseline goniometers, and each of these give exact measurements that you can record. Other objective tests include girth measurements with a tape measure, leg length measurements with a tape measure. You would also use a tape measure for chest expansion measurements in the case of a thoracic spine exam. We use inclinometers to obtain straight leg raising measurements. We use reflex hammers for obtaining reflexes. Those are objective tests. Manual muscle testing is an objective test. It has a subjective component to it, but it requires a numerical assessment, so it qualifies as an objective test. Sensory testing, again, while it relies on a subjective component, also requires instruments such as monofilaments, pinwheels, and even the two-point discriminator. I like to do two-point discrimination testing because it provides me with a numeric finding. Usually, 2 to 4 to 6 to 8 to 10 millimeters around the hand. Tinel's tests are objective tests. Agreed, they do have a subjective component, but it requires the use of an instrument and an active procedure to which the patient provides a mostly objective type of response. Grip and pinch strength testing provide an exact reading on the dynamometer instrument. I like chest auscultation because that's an objective test through the stethoscope. Cranial nerve exam has many different types of instruments and substances that we use. The olfactory test for cranial nerve number 1, I use a vial of coffee that gives me an objective response by the patient. For vision, we use a Snellen eye chart. For testing cranial nerve 7, the anterior 2/3 of the tongue, I use sweet and salt substances. For testing cranial nerve number 8, at least the cochlear division, we have our various tuning forks. And so the point is to make sure that you're doing every single possible objective test, at least that are required by the AMA guides, for which you are supporting your permanent impairment opinion. Or I should say objective tests that support your permanent impairment opinion. And the rule is, do not leave the examination with any undone objective tests. No matter what kind of hurry you're in, no matter how late you're getting, never leave without doing every single applicable objective test. Remember, it's all about creating a persuasive report, and when you cite all these objective findings, it makes your report basically irrefutable. It shows to the reader that you performed all the necessary tests and that your findings are exact. Rule number 2, never, and that is never ever, fabricate a measure, an angle, a reading, a recording, or any other objective finding that you did not actually obtain. And since you can't fabricate a measurement that you didn't obtain, make sure that you do every measurement in the one-time face-to-face evaluation that you have. And I can be honest with you, and I can tell you that there have been times in the past where, for whatever reason, either I forgot, or I was in a hurry, or whatever, I left the exam without getting a crucial measurement, you know, a girth measurement for atrophy, or a straight leg raising measurement to assess for validity of lumbar flexion extension. You know, I left there without a necessary recording or reading. And when you don't have it, those that know what's going on with your report, and you can fool some people, but if you get somebody that's in the know, that omission is a glaring omission. You might try and cover it up and make it subtle, or try and dance around the fact, but someone who's reading your report that knows these medical examination procedures will spot that as a glaring omission, and it just makes your report less credible, less persuasive. And certainly don't ever go back and try and fabricate a measurement that you didn't actually obtain, because I've heard it said from injured workers. I've heard this before. I've never heard it regarding my own reports, thank goodness. I hope it's never happened, but I have heard injured workers say that they read an evaluator's report and that the evaluator didn't do half of those tests. So make sure that you don't find yourself in that predicament. Make sure to do every single objective test required, at least by the AMA guides.